Hi, I'm Dr. Sara Szal, and I'm the host of a podcast called Treated with Dr. Sara. And I practice precision medicine. I work at Thomas Jefferson University, where I take care of executives and professional athletes and also everyday people. And what I'm so excited to do today is to perform some myth busting. So here we are. Number one, 40 is too early to start perimenopause. False. Totally false. You can start perimenopause as early as your 30s, and it usually begins with mood swings, sometimes night sweats like the week before your period. You might notice that you've got weight gain, you've got more belly fat, your body is starting to change. What I find is that a lot of people go to their doctors at 40 or 42 or 45, and the doctors say, "Oh no, you're just getting older. You're too young for perimenopause. This is just part of the aging process." Wrong. It could be perimenopause. I would say assume it's perimenopause until proven otherwise. Check your damn hormones. Sleepy girl mocktails are the only way to improve your sleep. There are many ways to improve your sleep. Sleepy girl mocktails, I understand, is a trend on TikTok, and it includes cherry juice and some magnesium and maybe some fizzy water. Sounds delicious, but I would say skip the mocktail and go for the magnesium. Magnesium is so well proven to help you with sleep. The way I think of magnesium is that it's this nutrient that 70 to 80% of us are deficient in. And if you're deficient, the way you know is that you're tense, like especially through your trapezius and your neck. You've got this level of tightness and tension in your body. Maybe you're a little constipated. And so most of us need magnesium to release that tension, to allow us to sleep really restfully at night. And that's what I would go for. Now, I need to look up the data on cherry juice. I know that there's some data suggesting that it helps with uric acid and with metabolism. So I'll get back to you on that one. Cortisol face is a real thing. Yes, it is true. So the thing about cortisol is that it's the stress hormone. And for a lot of us, we've got way too much of it. So high cortisol levels, that does a few things. It makes your face more puffy. It accelerates the aging process. There's this idea that your skin is a mirror of your soul. And I would actually change that to say, your skin is a mirror of your cortisol. So high cortisol levels tends to cause more puffiness, more chronic inflammation. It can even trigger breakouts. That's part of the inflammation. So definitely cortisol face is a real thing. Some people have trouble differentiating between the puffiness they get with a hangover versus cortisol face. And I don't know that it's so important to differentiate between the two, because the truth is alcohol raises your cortisol level. So it's probably giving you both the hangover and also cortisol face. The best thing to do is choose something other than alcohol. There are no health benefits to alcohol. Microdosing is not good for you. Just say no to drugs. No, wrong. I am such a huge fan of microdosing. And if you're someone who's familiar with psychedelic medicine, I'm certified as a practitioner of ketamine, MDMA, and psilocybin. Check your local state in terms of whether it's legal. It's not yet approved by the FDA, except for the ketamine. But microdosing, small doses that are subperceptual, can be very effective. We know that it improves sleep. We know that it affects heart rate variability. We know that it affects creativity. We know that it helps reduce pain. So I'm a big fan of microdosing. The problem is we don't have a lot of science on it. So this is where you come in. We need more citizen scientist experiments so that we can see what's going on with microdosing. What are some of the benefits? What are some of the risks? Although I can tell you from looking at all the recent systematic reviews and meta-analyses, there were no adverse effects with microdosing. All stress is bad stress. Wrong. The thing about stress is that you need it. You need it to be productive. You need it to serve your mission and create great things. So the idea with stress is that it's kind of an upside down U. If you have too little stress, you're not going to produce much. You're not going to have, kind of the zip to get up and go in the morning. You need to have just the right amount of stress, kind of that Goldilocks position, the top of the U, so that you can serve your mission without burning yourself out. And then on the other side of the U is where you've got too much stress, too much cortisol, maybe you got cortisol face, and there's a cost to your body. There's a physiological cost. So what we want with stress is what's called eustress, EU stress. We want just the right amount so that we can be our most productive. We can feel connected to our inner divinity. We've got the energy to jump out of bed in the morning and to do all the things that we want to do. We want to feel our most alive, and that's with the right amount of stress. Cold plunge and sauna are not good for the body. They're not effective. Wrong. So the thing about cold plunge and sauna is that they do contrast bathing. So either together, kind of going back and forth between a cold plunge and a sauna, contrast bathing, that is very effective. It's been shown to reduce inflammation, helps you recover from exercise faster. It helps to slow down the aging process, especially sauna. There's so much data on that. Sauna alone has been shown to improve the risk of cardiovascular mortality. It helps you with all-cause mortality in a study from the Journal of the American Medical Association. Cold plunges and saunas have mostly been studied in men. We need more data in women, but definitely they show that they're a form of good stress for the body. The thing about cold plunging that you want to remember is that you don't want to do what I first did with cold plunging, which is I would go jump in the ocean and then I would, be shivering and then I'd cover myself with a towel and put a bathrobe on top and then I would immediately get in a hot tub. That's not so good for you. If you want all the benefits from cold plunging, you actually want to dry off naturally without a towel, without a bathrobe, without a hot tub. And that process of your body going through the stress of dealing with the shivering and then heating itself back up again, that really helps your metabolism. That helps to create more brown fat in your body, which is a good thing. One thing I hear a lot from my patients is that they expect that their sex life is going to disappear as they get older. And the way I like to think of this is your sex span. So you've heard of health span, you've heard of lifespan. Health span is that period of time that you feel fantastic and relatively free of chronic disease. Sex span is the same thing. It's the period of time that you're having fantastic sex. So a lot of people think that, like I did when I was in my 20s, that when I turned 50, I was going to fall off this cliff called menopause and my sex life would be over. Not true. So the truth is, you can continue to be a better and better lover as you get older. Sex gets better and more interesting as you learn more about your body and what you want and communicate it. So this idea that your sex span is short, this myth that your sex life is going to be over at midlife, totally wrong. Thank you so much for joining us. I'm so thrilled for you to listen to my new show, Treated with Dr. Sara. A new episode drops every Wednesday on Dear Media. I want you to take care, be kind to yourself, and remember, your body is always on your side.